Kamau for that kind introduction. I want to start just by saying I'm impressed by the turnout and I'm impressed by the standard of presentations. They are a very high quality, I must say. I want to confess that when we were deciding who should give this talk on the introduction of Professor Abdallah's memorial lecture, I actually volunteered because I felt that I was the best person to talk about this great man. But now I'm seeing Fatma Khalfan there, and I realize that there's actually an equally good person because we grew up looking up to Professor Abdallah. Professor Abdallah was actually a role model for many of us as we were growing up in Nairobi. I'll tell you a story. When we finished A-levels, we had applied to do medicine, and Professor Abdallah, who was in the selection committee of the University of Nairobi, later came and told me that Fatma Khalfan and Ahmed Twair's name were deleted from the list because they said these are Indian guys and they shouldn't be on this list of first-year medical students. So I'm quite impressed to see so many medical people here and of very high standards in this room today. It's very touching. So Professor Muhammad Abdallah was a pioneer of Kenyan nephrology. In fact, we call him the father of nephrology, just not in Kenya, but in the whole of Africa. He died on the 28th of May, 2020, when he was 76 years old. He was a teacher, a father, and a friend to many of us here, to many people in the nephrology community, and to many other people. But to me, he was always Dr. Abdallah, because even when he became a professor, I still used to call him Dr. Abdallah because that to me had become his name. I knew Dr. Abdallah well because he was married to my aunt, Shamsa. That's a cousin to my father, and we used to go to visit him frequently. In the olden days, people used to visit each other more frequently than now. The older colleagues will tell you that people nowadays, they're so busy, they don't visit each other anymore. And during our contacts, Professor Abdallah would always talk about how he used to save patients' lives in the ICU, his encounters with patients, and I used to listen to him very intently, and I said to myself, when I grow up, this is the man I want to be. Professor Abdallah hails from Malindi, and he was born on 11th of October 1943. He graduated at Makerere University. At one time, Makerere University was actually the best university in not only East Africa, but actually in the whole world. And it was quite prestigious to have said, I graduated from Makerere University. And he later went to study nephrology at McGill University in Canada. He would always mention that he was one of the first students of Dimitrios Oreopoulos. This was actually the father of peritoneal dialysis. And when he came back to Kenya, he introduced peritoneal dialysis, and we were one of the first countries in the world to start doing peritoneal dialysis. And he perfected it and introduced it both at Nairobi Hospital and at the Aga Khan Hospital. Professor Abdallah later went on to head the renal unit in Kenyatta Hospital. He worked at Nairobi Hospital and later permanently moved to Aga Khan Hospital. He was the founding member of African Association of Nephrology, and in 1990 became its president. He steered a task force on upscaling services in Kenya, which outlined a strategy for rolling out countrywide renal services. And that's why you see that all the 50 counties in Kenya have dialysis machines. It's because of his leadership, and it came to fruition while he was still alive, and he was very proud of this achievement. He was also instrumental in setting up the dialysis unit at Taufik Hospital in Malindi, the city of his birth, and later supervised its operations. Dr. Abdallah was a teacher at heart. Those who knew him well will attest to that. He spoke English eloquently, and his command of Swahili was superb. If you don't know, at one time during his younger days, he was actually a host he had a show in KBC. At that time, I think it was called VOK. And a lot of people used to look forward to listening to those talk shows of his. I first interacted with him professionally when I did my elective training at Aga Khan Hospital, and during one of the ward rounds, there was a patient who had presented with diarrhea, was dehydrated, and had gone into acute kidney injury. So he told me to take the stool specimen to the laboratory and go and examine it and come and give him a diagnosis. So I obeyed that, but I told myself, this is not what I had signed up for, to become a doctor. So when I finished my postgraduate training in 1995, he actually invited me to come and work with him. And I learned quite a lot from him. And I got an interest in nephrology and followed in his footsteps. And that's how I actually ended up becoming a nephrologist. Again, those who knew him will know that he was a very strict disciplinarian. He used to keep time. He was actually the first one in the hospital, and he was the last one to leave. However, he would spend the weekends with his family, which he loved so much, and he was quite close to. Those of you, again, who've known him, you must have attended many of his lectures. He used to give radio talks on Radio Rahma, and as I said, he was very eloquent. He's held several positions in the country. He was the longest-serving chairman of the Kenya Medical Research Institute from 1984 to 2002. It was during his time that Kenya actually discovered an HIV drug called Cameron, and we were on the world map of HIV from then on. So from us, Kenya Association of Medical Muslim Professionals, we pray that Allah forgive his misgivings and puts him in a place in Jannatul Firdaus. Amen. And all I can say is Professor Abdallah would have been proud of us today. Thank you very much.
Sorry, there's a technical hitch we are trying to overcome. Can you hear us? Okay, Assalamu alaikum again. Once again, my name is Hafiz Majeh, and it is for me an honor and a matter of pride to introduce my classmate from my high school days, Professor Shaukat Abdul Razak, EBS. They must have misapprehended his age when they gave him the EBS because he's not very old. But I mean, in terms of his accolades, that he was a classmate of Hafiz Majeh, well, that's one of his lesser accolades. I'm now going to go ahead and introduce Professor Shaukat. So he's the director for the Division of Africa in the Department of Technical Cooperation at the International Atomic Energy Agency. Under his supervision, he facilitates IAEA technical assistance, technical cooperation support to 47 countries in Africa, helping African members addressing their needs in various areas such as energy, health and nutrition, food and agriculture, industrial application, water and environment, and others, using nuclear sciences and technology for socio-economic development. Before joining the IAEA, Abdul Razak worked as CA at the Kenya National Commission for Science, Technology and Innovation. He has more than 27 years working experience in various leadership and advisory positions, including chairman of the African Technology Policy Studies, member of the Kenya National Economic Social Council, commissioner of the African Commission on Nuclear Energy. Shaukat is a fellow of the World Academy of Sciences, the African Academy of Sciences, the Japan Society for the Promotion of Sciences. He is a member of the Global WIN. He has published widely in international journals and scientific conferences. His undergraduate studies were at Egerton University here in Kenya, and he obtained his master's in science and PhD degrees from the University of Aberdeen in Scotland in the United Kingdom, and postdoctorate studies from the Shimane University in Japan. So without much further ado, Shaukat, the floor is yours. Please give us your wisdom. You want me to call him? He's put his phone on silent. Obviously he will, right?
Hello? And now you can hear me? Can you hear me now? Okay, once again, Salam alaikum. I hope you can be able to hear me. Let me take this opportunity to recognize the presence of the president of the Kammp, Dr. Ahmed Tahir, the director, CDC, Dr. Ahmed Ogwell, and the CEO of Kenyatta University Teaching and Referral Hospital, Professor Ahmed Degane, all the medical professionals who are present there. My brothers and sisters, once again, it's really an honor for me to have this opportunity to be invited to give my remarks on a topic that I was requested to pick, atoms for peace and development, but most importantly, to really celebrate, if you like, this memorial lecture of our senior late brother, Professor Muhammad Said Abdullah. It's very important that we take cognizance of the great work that he did, and I'm not going to really deep dive on this, but just to remind ourselves that he was very instrumental in setting up the kidney center at the Kenyatta National Hospital, assisted several countries, including Uganda, Tanzania, and Rwanda, to ensure that they can be able to increase specialists, kidney specialists, if you like, and also providing training of trainers. And this is what I wanted to do today, really to speak more on these issues of capacity building. Of course, quite a number of you went through his hands in terms of postgraduate training at the University of Nairobi, and he mentored quite a number of people. I was honored and privileged to have met him and got treatment as well from him. He, of course, played a very critical role in fighting of HIV and AIDS as well. Now, just very briefly, you all converted in the room. You do understand this is your profession. From where I'm coming from, I see medicine as a noble profession in Islam. Islam emphasizes on the spiritual rewards of these, those who alleviate suffering, heal the sick, and of course provide care with passion. So you are really on the right track, and we need to continue with this dialogue, which is very important. Our Prophet Muhammad sallallahu alaihi wasallam praised the act of healing and the physicians who engage in it. Of course, providing health care is seen as a sadaqah. You know, innamal a'malu binniyat, and it all depends on how you pursue sort of these services to humanity and of course alleviate the challenges. There are quite a number of disease burden on humanity. Again, just to pick some few examples of 1.4 million annually have got TB-related death. Non-communicable disease causes almost 71% of the global death. We have more than 260 million, which are, of course, affected by depression. I'm putting this on the table because all these discussions that you are having, it's very important that we remain live on this. And healthcare providers are really key in reducing some of these key burdens. Very quickly, I'm just going to pick from where we were to where we are and where we are going. In terms of the trends, we see that medicine was in the past largely reactive, focusing on treating diseases after they've occurred, with a very limited technology and diagnostic sort of challenges. Again, limited access, and later I will jump into cancer, and you'll see the scenarios that we have in Africa as far as the access of healthcare, which is very limited. And of course, there are quite disparities. For me, really, looking at the continent of Africa, now 48 countries, I'm able to do some comparative analysis, and I see these huge disparities. And I'm sure even within our own country, in Kenya, you see disparities within and in different regions and in different counties as well. But again, we also have limited treatment options. Now, what we have is really a shift towards preventive care, which we focus on the early detection and, of course, prevention. This is very critical. We have advances as far as the genomics and personalized medicine, and then later I'm going to talk about nuclear medicine and how this is being really tailor-made, if you like. Telemedicine and digital health is also another sort of very important area, of course, offering remote access to healthcare services. There is an improved access to medical information consultation globally, but there is still room for improvement. And of course, looking at the medical advancements We have precision medicine, targeted therapies, and of course, by the end of the day, then we are expecting better life expectancy and of course, improved patience. Now, if I come to my topic of the day, atoms for health, I chose this topic for obvious reason. The International Atomic Energy Agency, we do provide the opportunities to promote healthcare at the global level. We have an experience of over 60 years where we supply safe and effective use of nuclear techniques in medicine, bridging the gap in terms of disparities in access of radiological services, for example, inadequacy of infrastructure, training, and education. And we do work very closely with our specialists and member states and develop a curriculum in this area. If you look at areas of early diagnosis, early and timely diagnosis, this is very critical. And at the IAEA, we do support the modern equipments and techniques for accurate and timely diagnosis of problems such as cancer, vascular diseases, kidney diseases. And you know as doctors that this is very important because with proper diagnosis, then you have that increased chance of effective treatment. Patients have been we've seen that patients have been treated without sometimes proper diagnosis, which really, is mainly due to lack of strategic planning and prioritization. We see the challenges in radio diagnostic services. Hence, that results into suboptimal care, and we see these are quite a number of challenges, not only affecting Kenya, but very many countries in Africa. We've also seen a lack of or not fairly distribution of equipments and facilities such as radiologists, experts, equipment for radiology purposes. And statistics show us that almost 25% of African countries have no access, for example, for CT and CT scanners, and 40% have no access to technologies such as the MRI. If I give you further statistics in radiology, for example, we know that on average, a radiologist density in Africa is about 0.06 per 100,000 population, while a global figure shows a 1.46 100,000. So you see that there are rooms that we need to improve in that area. So we have to continue providing that training for radiologists, but at the same time, you will see that in this country, if I just pick the area of cancer, the statistics according to GlobalCan shows there are new cases almost in the tune of 42,000 cases, and we register, for example, 2020, 27,000 deaths as far as the cancer is concerned. But of course, we have some trends that we see in the country. If you look at the support that you provided, we have provided in Moi Teaching Referral Hospital. We are bringing now a LINAC machine to Mombasa. We have another one that is coming to Nakuru. And of course, we are also working very closely with Kenyatta University Teaching Referral Hospital and see how we can be able to expand that area. Now, this is one area that is very critical that we talk about it, because we know very well that there are patients that will definitely require radiotherapy. And we know statistics shows us almost 60% of the patients in their journey towards treatment will require radiotherapy. It's appalling to note that almost 75% population in Africa have no access to a diagnosis and treatment of cancer, including radiotherapy. And this country as well, with just about 8-9 sort of centers, looking at the 53 million people, our recommendations are maybe one machine per million. So you can see the gap that we have. That's why the IAEA continues working with the member states to see that we can be able to bridge this gap. In fact, 20 countries in Africa do not have a single radiotherapy center. So Kenya, by all standards, is much better. And as I've said, we are working very closely to improve this area. Nuclear medicine is another area which we do provide that support production of radiopharmaceuticals, which you know very well are very critical in terms of their importance of targeted and personalized therapy. And I'm glad that in Kenyatta University Referral Hospital, they have these cyclotrons. At the moment in Africa, we have got almost 8-9 cyclotrons, and the countries in Africa are able to provide or produce their own medical isotopes. So you can see there are some positive sort of trends, and at the agency we continue working under an initiative, what we call Rays of Hope initiative, where 48 countries in Africa have become member of this initiative. We have got other countries outside the continent as well that are part of this initiative, which we are really looking at how we can be able to diagnose, better diagnosis and treatment of cancer cases and bridge that gap that I referred to much earlier. As we move forward, there are opportunities in healthcare, research and innovation that some of the medical doctors there refer to. Of course, we have global health initiatives that I'm sure colleagues are going to speak about it, but also we have this now opportunity of artificial intelligence that can be also embedded in the medical field as well. Preventive and personalized medicine is very critical. But above all, we must be able to train more people so that they can be able to handle this. And this is where I really want also to put a lot of emphasis as far as the capacity building is concerned. At the agency, I'm pleased to inform you, we have these short courses that we're able to take people for training in different spheres: medical physics, oncology, nuclear medicine, radiotherapy, and so on and so forth. We have a program of what we call Marie Sklodowski-Curie, specifically for young women who would like to pursue different careers in nuclear science technology. We have PhD sandwich programs. We do help countries when they want to have curriculums. Now we have curriculums in radiopharmacy, medical physics, oncology, nuclear medicine, and so on and so forth. And also we go into nutrition as well, because it's very critical. As we continue, we provide services to our member states. Information is also available on our website. We have all these e-learning modules that they are free, and they can be also, you can have access and be able to use them as well. It's very important that whenever we talk about nuclear technology, we use it in a safe, secure, and peaceful manner. And in this case, we ensure that we develop the relevant standards, develop so that we can be able to protect the patients and the medical staff. We repatriate disused sources. If you've been using a source using cobalt-60, we can be able to repatriate that. And we also consistent in terms of the radiation dosimetry as well. And we provide a training in radiation protection officers in different parts. As I come to my end of my presentation, we've been talking about good health. It's very important that we fight against obesity, and we can be able to use stable isotope to determine, if you like, the status of obesity or even stunting in children. We see that quite a number of children in developing world, they are, because of malnutrition, they have that challenge. But now with the double burden in nutrition, you see that obesity has become a challenge, and you experts will be able to know this much better. Also, when you look at challenges such as kidney diseases, we have to make sure that you look into your health as well. I really want to encourage Kenya, Africa in general, to jump into these fronts now with the genomics, radiomics, and so on and so forth. These are innovative ways as we incorporate them into the medicine. Technical cooperation provides that support to the member states, including Kenya, in both capacity building, training, and of course, provision of basic medical equipment. As we go into the future, we always have to look at the past, and we've been leaders in these fronts as Muslims. And I want to really to commend all of you for all the efforts that you're doing under this professional body, and also reflect back to see how these giants of the past have really advanced as the medical knowledge is concerned, that has really influenced medicine where we are today. We've seen remarkable heroes that continues to influence the modern healthcare ethics and scientific advancements. It's very important that we continue looking at the history as we go into the future, and we must be able to see how we can be able to make our contributions. As we move forward, I just have some few parting shot just to encourage a strengthening of networks, professional bodies like yours, professional bodies of radiologists, for example, nuclear medicine. We have all this with our support at the agency, radiopharmacists, for example. We have all these associations in Africa. And I want to encourage you in your different disciplines, you could be members of this. How do you have any challenge as far as the brain drain, so that we can be able to reverse that towards the brain gain and brain circulation, getting people from the private sector, public sector, and be able to work together? We have very excellent medical professionals, but I still feel that there is a challenge when it comes to leadership as far as the medical professional is concerned. So I'm advocating here for a program to train the next generation of leaders in these fields. It is very important we continue building that partnership, synergies and collaboration between you as professional bodies and the policy organs in the country as well, and of course in the continent. And as one of presenters said, it's very important that we craft this agenda for Muslims by Muslims. We must be able to make contributions in the Islamic institutions in this country. And I think this is one thing that is in my opinion, inadequate in terms of the medical field. And really, we look upon you as professionals to be able to make that contribution. We have at least 2 universities, Islamic universities in the country, several colleges, and I think they would really be very thirsty to hear on what sort of contributions we could be able to make. Do we see a possibility of creating a fund for research and innovation for Muslims? How can we be able to go about that? Are there any chances of having publications more so that you can be able to demonstrate your capacity and capability in research? It's very important that we continue to celebrate achievers within our society and recognize them adequately. Here, I would like really to urge, where possible, a creation of Professor Muhammad Said Abdullah fellowship program, so that we can be able to continue remembering his excellent work that he's been able to do. But today really is, for me, an honor and a privilege to be given this opportunity to provide this memorial lecture of late Professor Muhammad Said Abdullah, as we call him the father of nephrology in this country. And you as medical professional, you will be able to know that much better. Once again, many thanks for giving me this opportunity to share with you my humble contributions into this, and I stand ready to continue working very closely with the association, inshallah. I thank you so much.
Thank you so much, Prof. I think, isn't it amazing the kind of breadth that Muslim professionals have? It's just a few hours into the conference and we've moved from prevention to metabolomics. Okay, from discussing diarrhea to managing childhood obesity using radioisotopes. That's the much we can do when we come together. And I think Prof has challenged us to get an agenda for Muslims by Muslims. And by that, I want now to invite Dr. Twahir again now as the president for Kammp. And I think that will be a question he'd be best placed to answer. Thank you.
Bismillahir Rahmanir Rahim. Thank you once again, Dr. Kamau. I also want to thank Professor Shaukat. Please don't go away. We'll need you in the panel discussion shortly. That was a really amazing and insightful lecture. We'll take your words seriously. In fact, some of the things you've recommended have already been discussed by the previous speakers, and we're actually planning to implement them. So I'll start by again welcoming you all once again to recognize the presence of Dr. Ogwell, who's come all the way from Addis, Dr. Dagane, who's a senior member of Kammp and also representing KU, and all the delegates that are here. I would like to welcome you all to this 5th annual Kenya Association of Muslim Medical Professionals Conference. It fills me with great joy to see many familiar faces that I've not seen in a while, and to welcome also new members. I hope that our secretary will recruit all of you into our Kammp membership. We need more members. We need more people to work. You can see we've been given a lot of challenges, and we'll need to work together to achieve these objectives. So in the brief time that the new office bearers have been in service, that is about 1 year since we were elected, significant strides have been made, I must say. We've actually managed to secure a new registration certificate for Kammp from the registrar's office. This is our testament to operating within legal frameworks. Again, I want to thank Dr. Ogwell for assisting us. Dr. Ogwell is actually one of the founding members of Kammp. I remember when with Professor Adam and Dr. Chaudhry, they were struggling to form Kammp. Those days I was a young doctor working with Professor Abdallah. So, Dr. Ogwell, thank you for the efforts you've made in assisting us to achieve our new registration certificate. Also want to mention that we've had 2 major medical camps. I say major because we saw in each of these camps at least over 1,000 patients. One was in Lamu and the other one was in Mandera. And these were not just the simple camps where you are going to see patients with URTIs and headaches, and these were actually screened camps where specialists were going to those camps, and the patients have already been filtered, and the specialties would go and review them. So like in Lamu, we had a urologist, Dr. Naji came all the way from Nairobi. We did several surgeries, and actually I think we did 7 TURPs. In Mandera, we actually had a neurosurgeon with us there, and he actually did several baholes there. So we've been doing a lot of work in this 1 year. The other major achievement that we've managed to achieve is we've acquired a premises in Nairobi next to Madina Mosque on Bagathi Road. There's a clinic there, or there was a shell that was supposed to be a clinic. Fortunately, the trustees have agreed to give it to Kammp for an indefinite period to set up a medical and diagnostic center there. So inshallah, this is the beginning of greater things to come, because we have an ambition of eventually setting up a level 6 training and research institution that is owned and managed by Kammp, which will align with an Ibadah-friendly plan. So, for example, when you are in these institutions that we are envisaging, a woman patient will be examined by a woman personnel. Patients who die will follow Islamic rituals, and this is a place where you'll be able to hear 5 adhans in a day. This is the dream that we have as Kammp. So again, we'll hold hands together because it's quite an ambitious dream, but I know we can achieve it together. During the 1 year that we've been in office, we've participated in 2 council meetings of FEMA. FEMA is the Federation of Islamic Medical Associations. It's a global body that encompasses many other medical associations in different parts of the world. And just to let you know that Kenya has been nominated to host the 2027 FEMA conference and meeting. So I think that deserves an applaud. So again, some of the activities that Kammp has been holding, and most of you have been participating in that, we've been doing community activities in the form of training in basic life support. We've been doing it in different mosques, both in Nairobi and Mombasa. This is through the FEMA Lifesavers Project. And furthermore, our engagement extends to educational links on both radio and television, as well as regular updates for our members. We've got a very vibrant educational committee. Dr. Nabila, who's heading that committee, organizes regular talks. And Dr. Jalab, who is very passionate about training, has been coordinating these basic life support courses in mosques. One thing that I want to say is just not academics that Kammp is focused in. We also have a football team called the Kammp football team, and it's won many awards. If you go to the Kammp desk, you'll actually see 3 cups there. I was hoping that the governor would be here and the Minister for Health, but unfortunately they're not, but their representative is here, so I'd like them to take a message. I want to appeal to the county health team to leverage on the vast expertise we have within Kammp. I want them to use us so that we can work together. We need to dialogue. You have all these brains in this room. Please, Governor Abdul Swamad, I know you'll hear this. Take advantage of us so that we can work together. By fostering collaboration, we aim to enhance the health and well-being of our community. Our commitment extends to working hand in hand with the county government and other stakeholders to ensure that quality health care is accessible to every individual in the country. So in closing, I just want to once again extend a heartfelt welcome to the annual Kammp conference, and may this gathering be enlightening, engaging, and enjoyable for all. Thank you very much.
Thank you, Mr. President. I think the part that I forgot to mention when I was talking about our breath was the football team. I think it's a proud moment when we have cups to show. Now, I think if you look at your program, we're supposed to have the CC of Health Mombasa, but for understandable reasons, she could not be with us. But in her place, we feel quite honored that one of us was introduced in the morning and gave a very enlightening lecture. I would want to invite Dr. Saumu back on stage to stand in the shoes of the CC today. Karibu, Daktari.
Shukran. Wow. Okay. Assalamu alaikum wa rahmatullahi wa barakatuh. It's a pleasure and an honor to stand before here again. Unfortunately, our CC, as Dr. Kamau mentioned, could not make it today. With the heavy rains, there's a lot of meetings going on, looking at the situation and just making sure that everything is right, also taking care of the people and the residents of Mombasa. So she sent her sincere apologies that she could not make it to this conference. But she sent her remarks, and these are her remarks that she was meant to read before you, so I'll just read them on her behalf. Assalamu alaikum wa rahmatullahi wa barakatuh. It's an honor to be among fellow Muslim professionals as we mark the 5th Kammp Scientific Conference here in Mombasa. There has been a growing pool of Muslim medical professionals in different cadres across the country. This is a great strength that we have, and we need to find ways of tapping into this strength so as to ensure our unity and towards achievement of our goals in supporting our communities. Diseases are on the rise and healthcare demands are increasing every day, with our world being afflicted by epidemics and pandemics. The health and well-being of our families and our Ummah at large is important for the growth of our societies. We need to stand united as Muslim professionals and support our communities every day, and not only during outbreaks and emergencies, for better health and prosperity of our Ummah and our nation. I do hope that following the conversations here in the next 2 days, we as Muslim healthcare professionals should be able to take up key points and come together, join hands, and unite firmly towards achieving better health outcomes for our Ummah. I wish you all fruitful deliberations and you enjoy your stay in Mombasa. Please be safe, especially during these heavy rains and with the slippery roads. Stay well, and may Allah bless you all. Thank you.
Thank you, Dr. As we move forward, now we'll be going into a panel discussion, and I'd want to introduce the panel moderator, and he will introduce the panelists. So our moderator is Dr. Mwachonda Chibanzi. I think all of you know him. It depends with when you started knowing him. I knew him as a certified noise maker and agitator. Yeah, he holds a lot of clinical and leadership positions, has served as a Kammp USG, has served in the board of Amnesty International, the Kenya COVID Fund Board Health Committee, and was most recently the chairman of the Mombasa County Health Reforms Task Force. Dr. Chibanzi, karibu, and then you can introduce your panelists.
Assalamu alaikum wa rahmatullahi wa barakatuh. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatan min lisani liyafqahu qawli. It's an honor and great pleasure to stand before you. There are very many senior colleagues here, to be honest, and I'm quite humbled that I was given this role to moderate the panel. We plan and Allah plans. I think our plan was to have the Kenyatta University Teaching and Referral Hospital CEO Ahmed Dagane. We were to have the CEC Mombasa, CECM Mombasa, Dr. Sabah Ahmed Omar, and Dr. Ahmed Ogwel, I think, is here. You can come to the front, to the panel. I'm told Saumu will represent the CECM, so he'll come back to the front. I think, and then we'll bring on board Dr. Mohammed Shaush, who's the Kammp Coast Branch chairman. He'd also come in front. Yeah, so those, Professor Abdurazak Shaukat says he has to attend another meeting. So unfortunately, he'll also be unable to be part of this panel. So we'll proceed nevertheless with the panelists that we have on board. So how are the mics?
Sure.
You want me to sit? Yeah, so before we begin this panel, I think I'd like to introduce my panelists. I'll start from my right. On my right, we have Dr. Mohammed Shaush. He's a consultant interventional cardiologist and a cardiac electrophysiologist clinically. That is his clinical role in Aga Khan University Hospital, Mombasa. Kammp Chair, Coast Branch, and he was awarded an award last year. He was among the 100 most influential Kenyan Muslims. Dr. Saumu Salim is a consultant pediatrician in Mombasa County. She also is the head of medical specialists in Mombasa County, and that's the role that has allowed her to be part of the panel and also deliver the speech on behalf of the CEC. Dr. Ahmed Ogwell is a giant. Not physically, but experientially, in terms of experience and expertise. As rightfully said by the president, he served as the first Kammp secretary in 1998. And since then, I think he's really moved up the ladder. He's currently the deputy director at Africa CDC. Africa CDC is an organization that works with Africa Union members. So we have the entire African region, the African Union members. And he's a well-respected expert in public healthcare with over 25 years of experience in different settings, ranging from the national government, non-governmental organizations, to the United Nations system, and currently now in the African Union. His expertise includes health emergencies, including response to disease threats, preventing and controlling non-communicable diseases, including mental health, influencing health policy. He practices global health diplomacy, and he's been recognized for leading the negotiations for the Tobacco Control Treaty, and also contributing to the implementation of the WHO Framework Convention on Tobacco, particularly in the African continent. He's one of the pioneers also of the Intergovernmental Working Group of the Public Health, Innovation and Intellectual Property in Africa. He's a Pan-Africanist at heart, apart from being a Muslim, of course. I think now you understand what I meant by he's a giant with that introduction. Yeah, so the theme of this conference is transformation in healthcare. And one of the 6 pillars of healthcare is leadership and governance. And the discussion we're going to have here is mainly around transformational leadership, because without leadership and governance going right, then every building block of the healthcare system fails. So I'll start with the local leadership, that is the host. And Dr. Saumu, this question will come to you. Now that you're sitting in for the county government, the Mombasa Governor, His Excellency Abdulsamad Sharif Nasir, was elected on a platform of transforming healthcare, which also fits this platform. And he came up with what was called, and is still called, the Mombasa Care. And I know you've played a role in implementing that. So the question to you is, what are the challenges that you have faced so far in implementing Mombasa Care, and the opportunities moving forward? There's another mic. Yeah, there's a mic there.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much, Dr. Mwachonda. So briefly, for those of you who are maybe not aware about the Mombasa Care Program. So Mombasa Care Program is all about ensuring that the residents of Mombasa are able to access healthcare services affordably. It's about access and affordability. So what the governor aimed to do was enroll residents of Mombasa County into the NHIF program, whereby the county now will be paying for the NHIF program, whereby you have members and their beneficiaries and their families, and they can be able to access healthcare services at the facilities within the county, all throughout the county. So far the program has actually taken off, and we have over 15,000 residents who have been registered into that program. That is just the primary members. Of course, now they'll have the other beneficiaries to include their wives, spouses, and their children. So far it has been quite a journey, just trying to get everything in place, make sure that they actually, the members are actually registered. We had medical camps running all through just to be able to invite members into this. And alhamdulillah, we are grateful that the program has now kicked off since this last quarter. It started in October, actually. That's the second quarter of 2023-2024. So October, November, December, we've had some residents who have started accessing care. So those are the good things that are actually happening right now. The challenges with it is that as much as we have healthcare facilities in Mombasa County, but of course the one coming out is that the status, of course, of our public health facilities needs also to be improved so that we can be able to offer quality healthcare to our residents. So that is what is being worked on. And then, of course, there's even an issue of some areas, like, for example, in terms of access, we have some wards in Mombasa, I think a few wards in Mombasa, especially in Kisauni sub-county, which do not have nearby facilities. So there are projects that are actually coming up in terms of setting up healthcare facilities. This is just to ensure that at least each and every ward in Mombasa County has a healthcare facility whereby the residents can actually have easy access to it. So the opportunities that we have with this one is that it's something that still requires a lot of investment, especially in terms of monetary investment, because for continuity of the program, and also for now ensuring that we upgrade and also strengthen healthcare service delivery for the residents of Mombasa.
Thank you very much. I think quite insightful. I believe you all, for those who didn't have an idea of what the county government of Mombasa is trying to achieve in healthcare and transforming healthcare, I think she's really run through the objective. So my question now goes to Dr. Mohamed Shaush as the host branch and the chair of Kammp. What are some of the challenges and opportunities that you have in mind in terms of opportunities, challenges you have faced in trying to transform healthcare as Kammp? I know there are national officials, but you could just also give us just an idea of how you are transforming healthcare as an organization.
Assalamu alaikum. Thank you again. So from Kammp, mainly we are having opportunities through our members. For example, today's first talk, our brother Abdulaziz, he came in to the local setup and established a service that previously which was not there. For example, interventional pulmonology, whereby someone would need previously to travel all the way to Nairobi to have a scope just to check, maybe to be normal. Or you need a biopsy or you need a lavage and take a specimen. Number two, expert services. For example, we have a brother performing spine surgery, Dr. Rashid, who is here also. These are services that people used to travel all the way to India or to Nairobi to have them. We have also services in cardiology, which me and my brother, Dr. Saleh, established the cath lab and now going ahead and training other people. Adding to that, one of the feedbacks we had recently were colleagues asking for specialists from their specialty to come here, collect patients and teach them techniques or skills to improve outcomes in their surgeries. So locally, from the Kammp perspective, that is at a personal level, and from the association itself, it's organizing webinars and symposium to improve the local capacity of clinicians, nursing care, and perioperative. Thank you.
Thank you. Dr. Ahmed, you sit at, I'd say, a pivotal position in the African continent, and also that links internationally. As at the Africa CDC, what are the opportunities that you envisage to transform healthcare in the African context, the regional context, and now at a country perspective?
Thank you. Bismillahirrahmanirrahim. I'd hoped to speak a lot more local rather than the global continental level, but I will answer that. But let me start by thanking the Kammp team for insisting, is the word, that I be here today, and it's my pleasure to come back home. I grew up not too far from here in Kongoya, so this is very much home, and I'm glad that I was able to make it this time. Last year I couldn't, and I promise that I'll try my very best every time there is a function that I come. I don't know why it's always in Mombasa, but I leave that to Kammp president to see, because we are many across the country, and all the meetings coming to Mombasa, you never know. If we went to somewhere else, we may get a few more people. Then second, members. Second is the link between what's happening globally, what's happening continentally, regionally, and eventually nationally is a very thin link, meaning the differences are not many. And I would like to suggest 5 things that we need to do to ensure that we are getting the best outcomes for health in general. Sitting here and listening this morning, a lot of the conversation is around clinical work, and a lot of it is around the hierarchy that we are focusing on is very clinical rather than community-based. So hopefully the future speakers will try and focus on that a bit. But the 5 things that I would like to suggest are really what we should be focusing on. One is institutions. And Ahmed, just a little bit of history and stories from the back in the time you're sitting next to Rishad. He is one of the people who we first discussed the need for an institution like this. It was not Kammp at that time, but what we were thinking about is what you've just proposed here, that you are planning to have a level 6 facility. Kammp came from discussions of where are the healthcare facilities that are Muslim, in infrastructure, in services, in personnel, who knows, even in patients that are going to be attending those facilities. That's where it started. Then, because you need an institution to drive an idea, it then graduated into the need for an association of Muslim medical professionals. So many years later, seeing where we have reached, it's really gratifying. But first is we need institutions that function. And today, apart from Kammp, I don't see in the health sector any other institution that is Muslim in nature. We work in fantastic facilities across the country. We attend to the who and who's, but we don't have a Muslim facility. We don't have a Muslim institution that is actually going to ensure. We rely a lot on politicians, but I like politicians because so whatever I'm saying is not because I don't like them, but they are not the best of leaders when it comes to issues that affect the community. Many times they will look at themselves first, and then the community will probably be number 4, number 5, thereabout. But institutions that are Muslim in nature, it's only Kammp. And we need to change that for it to be able to function. As I said, I grew up in Kongoya, and the last time I was here, I went to the health facility there, next to the market. It has not changed since I left Kongoya in, 1984. It hasn't changed. The only thing that has changed, and I was hoping to tell the governor that, is that there is a new coat of paint. Otherwise, the structure, the fencing, the infrastructure inside, there are even fewer staff there than there were then, as the population has grown. So institutions is the first thing we need to really strengthen. How do we get Kammp to expand to include all other medical professionals, whether it is physiotherapists or laboratory scientists, whether it is the consultants or the students? We really need to strengthen the institution to be able to address our issues as Muslims here in Kenya. The second is the workforce. And I'm deliberately not saying public health or health workforce. I'm just saying the workforce. Because to solve and address our issues within health, we need workforce beyond health. We need lawyers, we need engineers, and others that are going to support delivery of efficient, optimal healthcare to the population. So how do we get the right workforce? How do we get to interest the younger generation to walk into public health, to walk into the health sector? How do we interest the younger generation to actually take up leadership positions, which has been discussed here quite a bit? That mentoring and mentorship process is still not solid within the Muslim community. And we need, for those of us who are occupying certain positions, to encourage the rest to join. So getting the right workforce to be able to drive that agenda is very important. Third is, and this goes to the discussion we're having in the morning here about whether the intervention is $1 or $2 or less. We need to start ensuring that the materials we need within the health sector are, as far as possible, being either manufactured or procured locally. Because we tend to only buy what has been manufactured outside. You'll recall during the COVID-19 pandemic, at the height of it, we didn't have masks. We didn't have sanitizers, and we struggled. But there are facilities that were repurposed to manufacture masks, to manufacture sanitizers, even other PPEs. But today, we are importing masks. Today, we are importing sanitizers again. It means that we are regressing so rapidly, because it is barely a year from the time that we really needed some of these facilities. But how about other things that we need within the health sector? Who is manufacturing them? And where are they coming from? Because this is what is going to create jobs and expand opportunities for the communities in the country, and particularly us as Muslims. And I think the Muslim community is in a very good place to be able to do that. We hold so much resource in this country, but it doesn't show, because it is in the hands of only few and not being spread out to others. The fourth thing is our resources. As I said, we hold a lot, but it's not visible. And that is why, for the simple study that was being shared here in the morning by Prof, we have to go to Gates Foundation. I didn't want to ask how much the study cost, but I'm absolutely sure that the resources within this room will have funded that study without any problem whatsoever, because the resources are there. So how do we use domestic resources? And that is not only money. It is my knowledge and your knowledge. It is my institution and your institution. It is my money and your money. How do we galvanize and mobilize those local resources so that they can address our own priorities? You know, the challenge of resources that come from far is that they always come based on their priorities, not ours. So you may want to do a study on the Muslim community about X, Y, Z, but then if the money is coming from somewhere else, they'll tell you adjust it to cover something different. And because you probably want the money to do your research, you'll adjust your research, meaning the results are not going to be exactly what was your priority locally. So domestic resources, capacity, knowledge, institutions, and eventually money, we need to mobilize it locally. Finally, is partnerships. And I'm really glad that Kammp is firmly part of FEMA. There's a lot going within the health sector with other Muslim institutions and bodies outside. And us learning from them and then learning from us would be a very good way of ensuring a stronger community. What I will propose for Kammp is, let's look within our neighbors. Rwanda, Uganda, Tanzania, South Sudan, etc. What are they doing in as far as the health sector is concerned, where we have professionals coming together? We could actually be able to create momentum if we did that much more closely. So to answer your question, what's happening globally, continentally, to link it with nationally, it is largely those that is happening at those different levels with different focus. And we can be able to translate it to make it really good for us. One last message to the governor. We've seen facilities, beautiful facilities. Coast General is much better than it was before, but we are not hearing much about community health workers. Mombasa is, I was telling a colleague, Mombasa is the ideal place to actually get healthcare to be visibly changing the situation within the community. It is small, it is wealthy, and it is educated. These are what you need within the public health sector. This is what you need within the communities. So, but we are not seeing community health workers participating in that link between the knowledge and the person on the street. I wish there was a way for Mombasa as a county to take that leadership and then deliver it well for others to be able to follow. Thank you.
Thank you very much. Quite insightful. Before I ask the next question, would you be willing to put a point or two about the community? I'll give you the right to reply. On the community health workers in 2 minutes. Maybe what the county has done and what's the plan. And on that, on the background of that, there was a health reforms task force that handed in a report that looked at the whole healthcare system comprehensively. Yeah.
So thank you very much for those remarks. So first of all, as Dr. Machonda mentioned, he was the chair of the task force. So the health task force actually looked at especially one of the components was the health infrastructure. And I agree with you. I also grew up in Kongowea. So we shared the same stories of Kongowea dispensary. And I know it's also one of the things that I've really been, advocating for in terms of change for that facility. And based on the task force report, there are quite a number of changes that the governor is actually looking into, especially in an area like Nyali, whereby it doesn't even have a level 4 facility. So those are some of the things that are actually in the pipeline. Discussions have actually started looking for, like I said, everything comes with its own financial burden, the cost, and looking at partnerships and how to partner up in terms of improving even the infrastructure of the healthcare facilities that we have in our county. So Kongowea is one of those facilities that has also been earmarked. So thank you for sharing that. The other thing about the community healthcare workers, I think currently it's not just Mombasa, but the entire country, there is a move towards, like the way said, the move now is towards universal healthcare coverage and especially primary healthcare. So community healthcare workers currently are actually being engaged quite extensively. I think Mombasa County has got over 6,000 of them in each and every sub-county. And these are what in Mombasa we call the foot soldiers of the governor. So they are actually there. They have been engaged actively. They actually participate in all community activities. They're the ones who actually aid, especially in mobilizing and also sending the messages to the communities. And there is even what you call the community healthcare workers. There's a bill that I think is also at the county assembly level on how now to strengthen issues of community health. And then there is also what we call empowerment of the community healthcare workers. There's during the Mashujaa, it was Mashujaa Day, I think there were some kits that were actually launched from the national government all the way down to all the counties, whereby they're actually going to be empowered and see how best they can be able to take care of our communities and within Mombasa, and not only just Mombasa, but I think it's the entire country. But as for Mombasa, I can honestly say there's a lot of engagement that is happening with the community health workers, or they're calling them the community health promoters currently, which is a huge milestone, especially for us. Thank you.
Yeah, thank you. Now that brings me to the question. Medicine is actually a social science. On one, it's a very long spectrum. On one end, you have the practitioners, which is the professionals. On the other end, you have a patient. And then in between, you have a community and a society. And that's what healthcare is all about, impacting the society. So the question to you, Dr. Shaush, in terms of collaboration and partnerships, and I like the lecture, the talk from Professor Shaukat, he was to be on this panel. Just to give you the overview is that where he sits at IEA, he's been able to influence to a level that now we are having Linux cancer care machines in the country. And that's what transformational leadership is all about. So, and that's part of collaboration and partnerships. So, in that context, how is Kammp moving forward, seeing the opportunity for collaborations and partnerships to not just the patients directly, but to the community and the society?
Thank you again. It's a very wide approach to this. What currently has been going on is just like our recent webinars have been given by non-medics. And the reason is there are some things that we wish to do. For example, if I want to control hypertension in Mombasa, I cannot use my clinic. It needs to come from a public health strategy to train, advocate, empower people. But also through Kammp and associating itself with other societies like Red Cross, getting involved when we were active, actually being bombarded with everything from COVID. We were getting involved with the Muslim society. Number two, imams who can influence. Someone in a khutbah can influence much more patients than you in a clinic. Ministry of Health, when HPV came in, getting involved about advocating for this vaccination, does it help or not? But also now with the blessings of the networking. Now we have people, for example, Dr. Ogwell, we have Aisha from AU, we have people going to IEA. From those perspectives, they see us in a different lens of what we can do, and we get recommendations. Also, we can give our pleas and needs to them in order to solve our problem. So as much as we try and network here, a cardiologist, a nephrologist, a surgeon, a gynae, but now it's high time for Kammp to go outside medical fraternity and develop networks that will make it better and bigger.
Okay, thank you. Dr. Saumu, on the same issue of collaborations and partnerships, as a county government, there is a very ambitious plan of Mombasa Care and transforming healthcare. But what is very clear is that Mombasa County government cannot do that alone, given that if you look at the resources that are required, as Dr. Ogwell said, if you look at what is required, it's quite clear that the county needs to collaborate with other organizations and have a very strong network. So what are the opportunities that the county, or rather the county, is foreseeing in terms of trying to implement this healthcare transformation agenda in Mombasa?
Thank you for that question. As you mentioned, it's an ambitious idea, and it's going to be an ambitious undertaking. But currently, the Department of Health is actually exploring quite a number of opportunities and partnerships, especially when it comes to strengthening the healthcare systems. And these ones are not only being sought just locally within the country, but also now you're looking at international also organizations. And one of the opportunities that is actually there, I should mention, is that Mombasa being a coastal town with, as Dr. Saade mentioned, we are Muslims, though the figures do not reflect that, but being majority a Muslim community, there are quite a number of positive engagements with even Muslim nations, like countries, like opportunities that can be tapped into, so as to, you know, because the whole idea is, like you say, it's not just about the residents, all the residents of Mombasa, but even can use as how we are going to help our Muslim Ummah. So the opportunities that are actually there is not just about local partnerships or local organizations, but even international organizations in other countries. There's quite a number of interests that has actually been raised, and those are some of the avenues that are actually being followed up. I know some of them were there previously, but now it's just a matter of taking it up and see how we can be able to strengthen. And some of the things that are actually coming up, it's not just about putting up new healthcare facilities, but even moving forward, like example in setting up like a Muslim, let's say university or institution, even if it's going to be a local one, everything has to start from somewhere. It's not going to be like University of Nairobi today or tomorrow, but then there are still, you know, those ideas that are actually being proposed moving forward, like can we have this? And then now peg, let's say, for example, facilities and institutions also under this. But I think as a county in Mombasa, we stand at a very, advantage position, especially being a Muslim county, whereby we can actually have that leeway of exploring these opportunities, even with the outside Muslim countries for partnerships.
Dr. Ogwell, on the same length, what are some of the, because I believe part of the agenda, of course, of Africa CDC is transformation of healthcare in the African region. So what are some of the collaborations and partnerships that you found most valuable in pursuit of healthcare transformation?
Thanks. Africa CDC is a member state organization. So our clients are country governments, not countries, but country governments. That's the structure that is there. So in this context, we engage with the Kenyan government much more than the communities, but we support whatever they have, the government will have identified as a priority. And therein lies an opportunity for an institution like Kammp. That how do we as Kammp get our priorities onto the government's priority list so that when the government will be engaging, for example, with us, then your priority is part of it. And this helps in getting those opportunities to trickle down to the community much more efficiently. This is one, in as far as our clientele being governments is concerned. Second is the knowledge that we generate across the continent is available to all, and can, whatever experience we have from, for example, northern Nigeria, will be quite relevant to our context because that's a largely Muslim community. So that knowledge that we are generating, we are making it available, it's on our website all the time, can be of value here. And this is one of the big roles that we play in as far as making knowledge accessible across the continent is concerned. Finally is actually providing support. And I'm using the word very broadly. We are not a funding agency, but we provide support. If the idea is good, it has come through government, then we commit to look for the resources that are required, whether it is expertise or money, to implement that kind of resource. Part of the reason why I was saying Mombasa is just right for some of the things that we would like to do. For example, we are right now supporting the establishment of public health emergency operation centers across the continent. Now, what could happen is the county here, Kammp, can put pressure a little bit on the government for the government to ask and seek regional level public health emergency operation centers. Tanzania has done it. We've done, I think, 4 so far. Kenya has not asked, which is a bit of a loss. But I hope that someone somewhere is going to ensure that regional public health emergency operation centers become a priority for the Kenyan government. If that is communicated to us, then we'll make sure that the county, for example, here or anywhere else where Muslim majorities are, can be able to get a proper functioning emergency operation center. Final thing to say, and sorry I'm getting into the space of Kammp, is membership. I think that's the best of partnerships. Membership. I don't know how many here are actually members, and I don't know how many...
Paid members.
3? I don't know how many health professionals in this country are actually members of Kammp, and we need to find a way of getting all of them to be members, and I commit that today I'm going to renew my membership. I don't know to whom I will go, but it will be really, really good, however silent we may be, because the little interaction I've had with Kammp over the last so many months is very few of you are taking up positions of responsibility. You leave it to the 3 or 4, and I think that is not very fair. So I challenge you who are here and who are listening online, so long as you're a Muslim and you're a medical professional, be a member, and be active. Just giving in money, then you sit, is not very useful, because even non-Muslims can be able to do that. Gates has given money for us to be able to do some work. He's not Muslim. He's on the other end of the spectrum. But what will you do after you've given your subscription? Be active, because that is, I think, the best partnership, rather than looking outside of the group, the community, and our area of work as health. Thank you.
Yeah. Thank you. If it were left to me, I think I would have gone on with this discussion on and on. But because of time, I'll open it up to the audience. Any questions? We have a question and answer session. Any questions from the audience?
We're going to take 2 burning questions. Okay, even if they're not burning.
Let me just ask, I would like Dr. Ogul to expound on something. So kindly explain the last point of membership. As we always have a question when we approach colleagues, please join Kammp and be a member. And they will ask me, why should I? And how would Kammp benefit me? Maybe please, if you can share. Because some of them joined as a favor. It's like when I pay Kammp, it's sadaqah for me. They're giving Dr. Muhammad sadaqah. So please, what the last point of encouraging, why should someone be a member?
Okay, so just hold on to that. Note the question. There's another question there, right? There's a question, huh?
No, it was linked to the same comment you asked about.
Okay, just go ahead.
But I think maybe to comment on that question is, it's not the issue of what will benefit. It's an issue of perception. As you're saying, Brother Shaush, Muhammad, first of all, you must understand, before we are doctors or whatever health professional care we are first Muslims. And that's where I think the challenge is, the perception, how you look at it. If you're looking at Kammp as just as an ordinary organization, which we, like any other organization, it doesn't say, now what I'm going to benefit from this. But if you're looking at it from the Muslim perspective, understanding the responsibilities and the benefits which you get locally and, I mean, in this world and the hereafter, it's another perception together. So the challenge, I think, with this is the perception of us. How are we seeing Kammp? By us joining Kammp, is it for benefit us, or are we benefiting by us joining that? Whether we get nothing from it, that's what we need to address, and that's where the challenge is. And this comes to another angle, which I think is missing. Yes, we do health, we do hospitals, we do this, but what are we doing about the spiritual aspect of developing the person in terms as a Muslim? Thank you.
Okay. Dr. Ogul, do you still want to, or I let it go? Yeah.
Yeah, I think that's beautifully answered. The only thing I would add is it's our responsibility as Muslims to create a community that benefits the community. It is our responsibility. It should not be a favor to join, or because we've knocked on your door so many times and you say, okay, take the subscription. No. If we want to benefit the community, then we should not be asking the other question that, what will this benefit me? So it's just our responsibility of being part of the community that actually supports the community. So this for me will be the biggest driver, but, and this is a big but, if Kammp becomes another gathering of health professionals, then it doesn't add value. Because there are many health professional gatherings that we go to. It needs to add the value of the Muslim part. That Muslim aspect has to be upfront and center of each and every activity so that we feel that as a community, we are actually benefiting the community. Thank you.
Yeah, I think with that, I'd like them to give us their closing remarks and the way forward on the whole transformation and what we've just spoken. What are your closing remarks? 2 minutes, 2 minutes, 2 minutes, and we'll be done.
The closing remarks from, as a Kammp representative, the community needs Kammp, and Kammp needs you. And there's no Kammp without you. So please, welcome to Kammp. There's a lot of work for all of us to do. there's a lot of ajr for all of us to reap. Come, let's join hands and serve the Muslim communities and ourselves to improve them and ourselves. Thank you.
Thank you. Dr. Som.
I think as we are all here seated as healthcare professionals, we have a duty and responsibility towards our communities. And I know I may be biased because I'm a pediatrician and I'm a child advocate, so I'll always look after the kids first. Apologies to the physicians. So my advocacy is that we need to take care, especially because nurturing actually starts from childhood all the way to adulthood. So these children are our future. These children are the future of the society. So we need to come together and so that we can be able to create a platform that will actually create a better health environment for the children so as to improve their outcomes. And also at the same time, still look at the adults and all other people, our communities. But I don't know, my priority always usually goes to the children. Thank you very much.
Closing remarks.
Thank you. A transformative healthcare will come from the relay approach. There are those who are ahead, and they pass on the baton to those who are coming from behind. So my message will be not just to Kammp, but for us as a Muslim health, medical professionals is let us create that relay where we are passing the baton to the next team, the younger colleagues who want to be leaders, the younger colleagues who want to make a difference. Let us create the relay approach and pass on the baton to those who are coming from behind. Thanks.
Thank you very much. I think it's been quite an insightful panel. I think the only thing I can say, this has challenged to the leadership. Having been in leadership, and I call all associations, organizations are movement building, where you need members. That's movement building. And in movement building, you really have to go out of your way and show people the value of them being in the organization. That's a no-brainer for me. So I think the challenge is, I know it's not easy. It looks very easy that there's Kammp here, why are you not joining? But in reality, as leaders, you really have to come out and show the members and the community that this is there for you to join and be part of. And once you do that, I think we'll not struggle with membership. Thank you very much.
Let's give them another round of applause, please. Shukran for the excellent discussions. A few housekeeping announcements. Whenever you see me holding the mic, just know it's time for food. It's either lunch or tea break. I can see the smiles in your face. Thank you, bro.